Hello, Dr. Pearlin. So, do you think it could be more dangerous for Omicron to spread faster than the Delta due to high mutations?
Yeah, it can be. We are seeing that the transmission rate is very high, and Omicron spreads really fast. And it looks like most of the Indians, not only Indians, all over the world, people may get infected with Omicron. They may develop immunity for that.
And on that note, like, how dangerous in general do you think this Omicron variant is? Are there any characteristics of this particular variant that you want to talk about?
See, when we consider about this Omicron, the disease, the symptom spectrum is very large. Okay, patients are from asymptomatic, some are mild, some are moderate, some are severe. But it's true that moderate and severe percentages are low. Then Delta, we have lot of patients in mild and many goes under asymptomatic. And people won't be knowing that they are having the virus in them and they act like carriers and it spreads very fast. Okay, and the second thing is, as the transmission rate is very high, we get lot of cases at a time and lot of burden falls on healthcare system.
Correct.
Not only healthcare system, when we take on office also, at a time many of the staffs will go into isolation. So these all problems Omicron causes to the economy and to the healthcare system.
Absolutely, totally agree with you on that. On that note, since we just talked about mutations, just one question back. Coming to children, since they are likely to be more vulnerable to be infected, so how about that? Is this true that due to mutations, even small children eventually will be infected with the virus? What are the chances?
See, what we have seen in the previous waves, children were not much affected. Okay, though they were affected, it was mild form. Okay. Thankfully, during Delta also, children's ACE2 receptors are not well developed, so their lungs was not affected. So now also this Omicron variant also, it's not having that lower respiratory tract problem. So children may get affected, but it won't be very severe. Hospitalization rate can be 1 to 2%.
Coming to the origins, actually, since our audiences, I'm sure they would like to know, it is said that this is a product of AIDS patients getting infected with corona, from which this whole thing went into an outbreak. Is this true, and how's this?
See, if a virus want to live, it need a host to survive. It can't just live in air and reproduce. It can't live in a table and reproduce. It need a host. So human act like a host. So when it comes inside our body, it reproduces. Okay. So when the virus stays inside a immune compromised patient or the patient those who have low immunity, there the virus tends to stay for a longer time, right? So when it stays there for a longer time, mutations may occur. So it's not only AIDS. Immune compromised stage can be many other diseases also. So we can't surely say that it came from
Only
AIDS
from.
and not from that. From any immune compromised patient, inside their body, virus can get mutation.
Understood. And now that, as we all know, from 10th of January, the government has opened up the opportunities to get the booster doses done. On that note, ma'am, Dr. Pearlin, what do you think? How effective are these booster doses? Like, what exactly is this all about? Why do we need it?
I personally feel that we need booster doses because the immunity what we received from the previous infection or previous immunization lasts for 6 to 9 months only. So as we all know, all the frontline workers and the high-risk people got their first shot in Jan 2021 and second shot in Feb 2021. So now they are almost 11 months. To such people, really we need booster. So If it is not booster, they will get affected from Omicron, and that infection itself will act like a booster.
Understood. So the booster dose pretty much works like just any other vaccine, or like the way it behaves, or
It's like giving extra push for the previous cover, previous immune cover. We are giving on extra push to that. See, for example, TT vaccine. So every 10 years we will just give a booster. Like that here also, because it's a new virus, we are still learning from that. Okay, so how frequently the booster should be taken is not well clearly mentioned till now. But when we look into people's, antibodies, COVID antibodies, spike antibodies,
the way
levels in the body,
is responding.
how the body is responding, we are able to know that it's not lasting for very long time.
And coming to people with asthma, like how are they prone to get affected by the virus, and what are some of the precautions they can take as basic measures to stay safe from this?
See, always asthma and COPD patients are at risk only. They and the people, those who are allergic to all the things, those who have allergic bronchitis and all these things. Because this infection, this virus stays in the respiratory tract.
True.
Okay, the tract which is already affected, okay, it poses a risk for them. And if they are not treated on time, the virus can go further deep into the respiratory tract, which can cause further bronchitis and then pneumonia, all that things. Consult the doctor at the correct time, and what all advice they are giving, nebulization or that and that, to be taken properly.
Understood, ma'am. And the next question that I have for the audience is that it's a pretty large debate, as you would also agree, Dr. Pearlin, that which one works best. Is it Covishield or Covaxin? I have taken this vaccine. Will it work for me? Am I better off? Am I going to be fine? That's a huge debate that's been going on for the last 1 year. So on that note, ma'am, are these two vaccines contrary to one another? Of course, they do what vaccines should do. Is there any difference between the effectiveness of these two vaccines, or are they at the same level?
I personally believe that both vaccines which we have in India, Covishield and Covaxin, both are effective. And as I said earlier, we have vaccines, different vaccines are there. So attenuated vaccine is Covaxin. So in Covaxin, we are injecting the same coronavirus which are inactivated. So I believe Covaxin is superior than Covishield, though I have taken Covishield only.
But you did mention the logic why Covaxin is, you would recommend Covaxin since you're injecting
the
inactive,
same virus, inactivated
virus.
Same coronavirus we are injecting. But when it comes to Covishield, it is vector vaccine. We used their adenovirus to modify, but we have injected and our body has produced spike antibodies against the spike. So that also effective. But when you compare both, okay, both are different group, but both are effective.
But meant to do the same job, right? I hope that puts some of the confusion of the audience to rest. Moving on, now that Omicron is already here, and then there's Delta, which is almost at our doors. Given the states that we are in, especially in the Telugu states, given the lifestyle of people, the economy over there, the way people go to work and all, not everything has been shut down yet, right? So with Omicron and the Delta variant at our doors, how risky do you think the situation is right now? And what are the measures that you would like to have implemented so that we are in a safe zone?
See, in current situation, the maximum number of cases which we are seeing are Omicron. Delta cases are very less. We have seen that in the month of December with all the typical symptoms of loss of smell and taste, which is not there with Omicron.
True.
So most of the cases now in January are Omicron cases. But I feel, lockdowns, how much it's going to affect. Only thing people already know. Since 2 years, we know how to handle the virus, how to sanitize ourselves, how to wear mask. Everyone are used to that. So imposing lockdowns only help people to realize the severity of the disease and to be more precautious.
True.
Okay, so Apart from that, I don't see much
I see.
difference in that.
Understood. And unfortunately enough, there's marriage between variants as well. So there's this another thing called Deltacron, so which is also being bothersome for all of us. On that note, there's rumors and there's word that's flying around that Deltacron is something which is specific only to India, and this is something that has come from a part of the medical community as well. So how far is this true, and how dangerous is this particular mutated version or this particular fusion?
I'm not in a stage to comment on that, how it came in India and all that things, okay? So it's true that in December from Cyprus, they reported that thing. That also under discussion now. So they are saying it may be due to lab contamination and all that things, but it's not yet clear. We have to wait and see for that, how it turns out to be, how it is emerging, is it infecting others, is it becoming endemic to one area, and is it spreading? So
You still have to wait and watch.
yeah, we have to wait and watch.
Understood. That's a wrap, gentlemen, ladies and gentlemen. Thank you for listening to us. Thank you once again, Dr. Pearlin, for your valuable insights. Stay tuned. Thanks.